So, as we know, today we will talk about the K Talk, and actually, the last of the K Talk season 2, we start with the project. This is the train your box because we want you guys trim out of your comfort zone. But this season, we will start with another project with another story, another journey, and can help you guys to persuade your what we call for that, like you're looking for something like treasure, and with the map we can bring you the map and you can looking for this in very we call this the desert Iceland. So we call that welcome to the map of treasure land. That's our title for this this season for the K Talk today. So you can see that's really beautiful. I cannot. That's from Bảo Chi. She's the person who designed all thing for this presentation today, and that's really impressive to me. And that's the first time, to be honest, that's the first time I present with the colorful and very well designed in this presentation like that. That's the first time in my life. So yeah, let's see what we can have in this journey today. So you are a doctor and you are traveling to the sea, but unfortunately your ship encountered a storm. Wow, that's the beginning of the story. And then yes, your boat was destroyed, and when you wake up, you find yourself adrift on a deserted island. That's kind of scary, right? And you don't know what you will do next. Okay, let's see how can we help you. And you're looking for the bottle. And you go around and you find a bottle with something inside. Wow, we'll see, so curious what inside. The adventure begins. So here the maps inside. Yes, here's a map to find the treasure hidden on the island, and you have to go through different locations, serving 8 patients and collecting germs to unlock treasures. And who will help you to do that? Yes, it's me. I will do caption, and I will bring you guys get through every step in there and save the patient. So that's our K Talk to start for this session. How about that? Are you guys ready to save the patient? And let's start with the taking medical history to have to conquer the challenge behind. So let's start with our lesson today. Finish the story. Thank you so much, G. Very good in the content and also the design.
Yeah, I'm very happy to hear that.
Yes. So go to the main section. All right, so let's start with the introduction. And actually, you guys know a lot about medical history, and that's kind of very popular for every medical student, even when you are in a medical school or even after you graduate. You also have to get stick on that every time when you work in the hospital. So what's in the medical history, as you know, based on your knowledge? Let's start with Long. Is it difficult to define this?
Yes, in adult patients, I can ask them directly, but by the urge, everyone can ask them. So
okay. Yeah. Keep continue.
Yeah. So doctors ask their mother or father.
Yeah, but actually I'm asking about what the meaning of, or what you understand from medical history. How you understand that the medical history can help you to present which things.
Yes.
That's a very general subject, right? Sometimes we know that, but we feel really difficult to define this by your own. So How about Nidra? Can you have along?
I think that medical history is like some disease or some symptom that patient was patient passed in the past, and based on that we can divide the symptom into some disease that we are thinking about.
Okay. Yeah, kind of can give you the overview about what the meaning of medical history. Yes, the medical history actually is not the past. That's everything you collect from the patient about their symptoms, about their concern, about their past illness. So they combine together and can bring you the good overview about the patient. Can help you to go further about evaluation or a kind of something can make you the diagnosis. You know that. So that's the meaning of the medical history. And how about the pediatric and obstetric and gynecology history, maybe of guy history? That's the more specific than the general medical history, because that belongs to specific the subject. For pediatric, we know well, yeah, we will ask the child, but the child sometimes they cannot answer you if they are still really little, and you have to ask from their parents. And sometimes like you need to use another way to talk to them, and sometimes you need to be more patient to understand well about what happened to them, I mean in the child. And more for the obstetric and gynecology history, that belong to different things. And different things mean like you need to ask more about the history, or even like the symptoms will be related to what we call for that, like about sometimes gestation, about like menstrual periods, about like how their pregnancy, or even like some kind of disease related specific to that individual. So you need to recognize who is the main person you will collect the medical history, and after that you will define which one you will go, because they divide very specific type of the medical history for every individual. All right, so that's the first thing we need to differentiate between them. And next thing, how to take the medical history. Actually, that's a very big question, and actually like we need to learn maybe 3 years or even 6 years to make the good medical history, right? Because sometimes you think you make it good, but your teachers still say like you lack of this thing, you lack of that thing, right? So how to take a medical history? Before we start with that, we have 3 things we need to try to make it like work. First of all, you need to establish a good physician-patient relationship. That's kind of very important nowadays, especially like when their education really high, and sometimes they require lots of things, and they need to understand more about their problem. And sometimes if you cannot make the good relation between you and your patient, and you cannot go further with like diagnosis or treatment, sometimes you get a lot of trouble with that because they didn't cooperate to you. So the first thing needs to establish a good physician-patient relationship, or even like medical student and patient relationship as well. When you study in medical school, you need to build that. Every time when you do the clinical practice in the hospital, and you need to take the medical history, so you need to if you want to collect, you need to build a relation between them. Or even after graduate, you also work as a physician. So that's a very important point for you guys to know about that. The second thing is you need to precise documentation of symptoms. It means like you need to collect exactly the symptom enough, exactly, and clearly about the problem of the patient. Because if you cannot collect that, you cannot draw the picture. What happened to them? right? And the last thing is to develop differential diagnosis. Yeah, after all, you have all these things, and you need to go with like, what's your diagnosis? Because that's at the end of the conversation, even at the end of the medical conversation, or even this the medical checkup. After that, what is your differential diagnosis? They care about that. All right, so we need to sometimes we need to like acknowledge about have some way or some different about the type of medical history. Sometimes just brief medical history, sometimes it's a extended medical history. The brief medical history is mean like it means like you just if you are in the emergency room or the patient in emergency situation, you cannot ask the whole thing. Yes, list. You need to just brief what specific, what exactly, just very shortly and briefly. And that's what we call this a brief medical history. But for some time, like you have a time, we call this a non-emergency situation. So you can go with like you can step by step. Yeah, I will take this one, ask about the 7 characteristics of the pain. I will the next thing about the past medical history, about like social history, kind of like that. But you don't have a time, you don't need to do all this. You can do it later. We call it brief medical history and extended medical history. All right, so and to make the good medical history, you guys can base on the very important and very famous the structure nowadays. We call this a soft note. So let's see how soft note is. The soft note actually the abbreviation way to write out about for the characters of the medical history. First, it's about the subject. So that subject, let's start the S, right? Subject, when that start with the chief concern, or sometimes we call the chief complaint. So when we go with that, it means what we want to collect from that information. Sorry, chief complaint. What do we want to collect from that chief complaint? Or what the meaning in Vietnamese, or how can you understand from that?
Em nghĩ cái đó Vietnamese just concerns thì lý do nhập viện, cái mối quan tâm chính.
Yes, correct. The reason you go to the hospital, the reason you come to the hospital, or you go to see the doctor. Yes. So that's the chief concern or chief complaint. So that's the reason. And in the subject, you also need to collect about present the patient history. And the patient history is mean like this combined with the we call this medical history, past medical history, family history, social history, sexual history, all this. And you call this a patient history. So very a long list of the patient history. So that's the next thing you collect with that. And after that, you go with the review system or ROS. So ROS means like you go through the checklist, and you just very quickly you ask them about the subject, or even like the organs, the most organs you concern about this patient, like, and you just go further with that or deeper with that. And sometimes you get through all the others, the rest of the system, and you can understand about what happened to them in just a review system. In Vietnamese, they call this, what they call the name for that, review system. Hello. Let's start with the Linh.
You want to know about the meaning in Vietnamese of the previous one?
Yeah, what the meaning of that?
Okay, is thấm cơ quan xin.
In Vietnamese, they call this các cơ quan, kind of like, yeah, they usually put that in the medical history, kind of like that. Okay, and you get through system by system, and that's finished with the subject, mean the S. Let's start with the O. Yeah, O, this is the objective, sorry, and objective. You can start the vital sign. Sometimes we call this in emergency setting, or it depends how maybe it's in clinic or in the hospital, but wherever. And you need to collect about general appearance, pertinent physical examination, and the lab test. So that's we call the object. And sometimes in Vietnamese they mean like you get like this is sinh dấu sinh hiệu, or triệu chứng tổng quan, kind of like that, or khám, or đề nghị cận lâm sàng. Yeah, we call this the object. And let's start with the assessment. So after you have like subject and object, you will start with the assessment. The assessments mean like you need to start with the most problem or probable diagnosis, and you collect or you get from like subject and the object. And it means now you need to start with the differential diagnosis, and you can list the 1, 2, 3. Usually the 1, 2, 3, the most differential, not only the most, like differential diagnosis you have in your mind, and you can put based on the priority of that diagnosis. The first it means the most, the second is mean less likely thing, more than the first one, and the third one, yes, it's less likely than the second one. And usually like you should start with the 3. That's better to locate. You need to get a lot. And the last one, let's start with the plan. Yes, after all, you go with the SOA and you go with the P, like you outline the next step in management. Okay, now you have like the most likely diagnosis you have in your mind. So what you can confirm? How can you confirm that? Yes, you need to start. Maybe you how can you manage that? And you manage with like medication, you manage with like injection, you manage with like kind of like do some another treatment, kind of like that. We call this a management. And we need to list each patient problem separate and explain what they intended to. So we need to like separate about maybe their syndrome, maybe the problem separate, and then you need to solve one by one. Sometimes you can go with the symptoms. We call this the symptoms. Sometimes you have to go with the risk factor or the cause, because have some disease you know well about the cause. You just cut the cause and the disease can treat. But some disease unknown about the etiology, so you have to start with treat the symptoms. That's basically we can do. We cannot go with the cause because they don't have the cause to treat. You know what is, for example, like hypertension. You cannot treat hypertension with the cause. I'm talking about a primary hypertension. That's a no about etiology, right? Usually they treat the symptoms. Okay, so about more detail about SOAP workshop note. You guys can learn from Dr. Thuong Nguyen. He will present very detailed about how you can collect this one by one, and in practice how you can do it. And he can guide you to step by step to make the good short note in the next week on Saturday. Okay, so let's start with they keep continue with checking medical history, because we get through a little bit about the subject. In there they have like a medical history. So more specific in medical history, we can have about like chief concern, we call this the chief complaint, kind of like that. And you know the main reason the patient come to the hospital, and they or the clinic, and they come to see you, right? And usually that should come from the patient words. It means like this is not your words. You cannot put your medical term in there. You just ask them, and sometimes they just tell you like I have neck pain, I have like sore throat, but you cannot go with like pharyngitis. You cannot go with like neck stenosis. You know what I mean? Like sometimes you cannot put your words in there. You have to collect from what the patient talk to you, what the patient try to complain about their problem. So collect them words. And the next is about the history of present illness. SBI. And the history present illness is mean like what happened to them. What it mean like you need to draw the whole situation can make that chief complaint. All right, so we call this like in Vietnamese they call this the bệnh sử, and very clearly like you need to collect very like it depends on you. It can be that's very short, can be that's just long. It depends on the symptoms. It depends on the chief complaint. It depends on a lot of things. But you need to make sure you collect enough and exactly about what they have, and very like just try to use your knowledge and collect all of them. And the next still in the subject, this is past medical history, PMH. As I told you guys, the past medical history sometimes they combine with the pre-existing illnesses, medical history, allergies, medication history, kind of like that. Yes, they have this. Or social, no, it's not social, but surgery history. Pre-existing illness, you can divide like some disease we call this belong to the internal medicine. You need just resolve with the medication, but have some disease before they have to do surgery. So you also need to collect them. And more specific, in my experience when I work, when you go with those past medical history, you need to a little bit detail. Detail mean like you should go with like what type of medication patient use, the dose, how long, is it well controlled or lack of control? You know what I mean? Lack of controlling. It means like you can understand if you can do any consult to the patient, you can do with that. Like some people, they are hypertension, but they didn't take medication like daily, and their blood pressure usually like up and down, unstable. So just look at the past medical history. We know, yeah, he didn't take medication regularly. So that's the reason why in that point, how some students, they didn't pay attention to that. They just look like, yes, the patient have hypertension, the patient have diabetes, the patient have like the surgery of the, we call this gastrectomy maybe 2 years ago. All right, so, but with the hypertension, is it patient like take medication regularly? What's the medication patient taking? What's the dose? The dose for that? This high dose or low dose, you know, so you need to ask free detail like that. Or even like surgery, you need to describe like any complication after they do surgery, or just a very going well, went in well in that time and no complication until now. So that's the reason why past medical history, you need to a little bit like more specific to have you or even like your supervisor know well about that patient. And still have another like family history or social history. We will go one by one and review system. All right, so any question for me in that slide, or I can move to the next? All right, so good. Can I speak, when I speak, is the curve very fast, or this is a very good speed? You can listen really well. If you have anything, just text me on the chat box. I can read that and I can adjust to be like be good in this presentation. So yes, we start with the chief concern or chief complaint. So as we know, that's the main reason, the patient come to the hospital or clinic. Yeah, the patient visit, and the goal of the chief concern is mean like you report the clearly about the patient own words like knee hurt, upset stomach, running nose. And when you're taking the patient medical history, the first question should be as open as possible. That's very important about this point. How anyone can tell me why you need to start with open as possible, as open as possible, or open possibly.
Well, we give the patient the chance to tell as much as possible about their concern, right? And then from this, we can ask more questions to determine what happened to them. I mean, firstly, we have to encourage them to speak more, to tell more about their concern. Yes. And then we will have the evidence, or we've been based on it to ask more.
Yeah, good, Bong. Yes, we need to start with the open question, because when you go with the closed question, because in our the way we take medical history, you have two ways to take the information. You can start with the open question, or even they say closed question. So if you start with the open question, it means you let the patient have the more space to talk. They feel free and they feel like comfortable to talk about their problem. Like if you start with the let me give you example. If you start with the closed question, like you have a knee pain, and they said yes. Sometimes, but it's not a knee pain. Just like maybe they have the back pain, but the pain can direct and radiate to the knee, or even like the behalf the knee. And sometimes they said the doctor say like that. Maybe this is correct. Maybe our the main problem is not look like that. Doctor say that. It means doctor correct. So they say yes. And you just write out, yes, the patient has a knee pain, but actually the patient has a back pain. That's a neck can that drive the patient into the wrong way sometimes, but not always. But let's start with the open question and let them have more space to talk. Encourage them to talk about their problem, and they will feel like comfortable and easy to describe. And for example, they say, how can I help you today? Or what brings you here today, or what brings you to my clinic today? They have many kind of questions you can start with, like that. We call this the opening question. Yep. So that's for the chief complaint. Let's start with history of present illness. We call the main story. Now we'll talk the first one we call it, this is the reason, but now we call it story. Yeah, the story of the reason. All right, so we need to go with the detailed description of the chief concern or chief complaint about the progression and the symptoms. Of the symptoms. So it means you need to describe this more detailed, more specific. For example, if you go with the pain, you need to describe the 7 characteristics of the pain. Or if you go with another type symptom, sometimes maybe like the patient feel what kind of another reason can bring the patient to the hospital. We call maybe that patient have bleeding. Yes, you need to collect the history of the bleeding, right? So that depends on the chief concern and you need to ask very carefully and detailed about progression of the symptoms. And yes, like this detail of the patient present illness and determining a system should be assessed carefully. That's the main thing. That's the reason why we need to know very well. Meaning assess carefully in the review of system and physical examination. You know why? If you cannot go well with that HPI and you still very concerned, you still very unclear about what problem the patient have. When you go with the review system, you go very general. You don't know what specific the thing we need to collect. You need to target this and go with that first. The others, the rest you can go after. Maybe this faster, or maybe that's just take. We don't need to spend a lot of time, because I know well about medical history. It depends. If you're a medical student, you have time to do that, especially when you take the exam. But for the doctor, in reality, you also don't have a couple of hours to take the medical history, right? It depends on your time, and sometimes just a couple of minutes, sometimes maybe longer, maybe 30 minutes. You have the time to spend for the patient. So you need to point out what is the thing important to take in review system or even physical examination. Some key elements In this history of present illness, we have like the onset. So what the meaning of the onset? Sorry?
Khởi phát.
Yeah, correct. Yes, the onset of the symptom is meaning that the context and location. General, they go with the context and location. When you go with the quality and intensity, what the meaning of that? And you can give me one example.
Here the symptom is?
Sorry, Mr. Ang.
Is that like how severe the symptoms of the patients? Like,
yeah, kind of like that. Good. You need to evaluate how much severe of that symptoms. So can you give me one example for that?
I don't know, like the pain, like the scale of pain.
Correct.
Pain and the intensity is like it could be like a throbbing pain, or it could be like a dull pain.
No.
Yeah,
just the pain, let's start with the pain again. Start with the pain, because we don't want to rate about the severe level. So what is that?
Yeah.
We should go with the scale of pain. The pain.
But I mean, I'm talking about the intensity of the pain. Sometimes like the patient like can describe their pain as a throbbing pain.
Let's start with the course. That's the course.
I don't know.
I'm sorry. That's start with the quality. You correct. I'm sorry. That's start with the quality of the pain. But you can go like the pain can start with like joint pain, like cramping pain, like sharp pain, kind of like that. That's okay. And I'm sorry, Mr. Ang. Yeah, I just you can go with that, but you can go with another way with the pain, with the scale of the pain. Scale evaluate the pain, like from the scale from 1 to 10. With the 1, this is the no pain. 10 is the maximum of the pain or the worst of pain you have ever had in your life. So how can you rate your pain? So sometimes the people rate their pain like 5/10. This means the pain just the average, moderate. That we call this intensity. For quality, like yes, like Mr. An said, that can be like joint pain, can be like cramping, can be sharp pain, kind of like that. And let's start with the cause. Who know what the cause is?
The cause is like the pain direction and spread out the orange. Like when you chest pain, it's spread out shoulder or cheeks.
We can say illustrate like the pain can usually like not chest, can be the chest, like have some pain belong to the diaphragm. Diagram, and they can radiate to the shoulder. But that's not actually, that's a cause. That is the cause. Usually, like we describe the pain like that's a sudden pain, or that's a gradually pain. That's a constant pain, or the pain just come and go. We can call this that's the characteristic of the pain, but like I cannot find a good word for that. But like I can tell you like my pain that just come and go, not constantly. Different with like that's always, I feel the pain always from the morning to the night. That's we call it the cause of the symptoms. You get that? You guys get that about that? The cause?
I'm sorry. So the cause is like, how can we like, is the characteristic of the pain like the symptoms, or like how, like when does it start and stuff like that, or what's how could you like differentiate between the cause and the duration of the pain?
The duration of the pain, like that can become like just start 2 days ago. Or the pain just start with like sorry, not the onset, sorry, that's duration of the pain, like the pain just like in 1 minute and this finish. the duration of the pain. But for the course, it means like the pain constant, or the pain like this thing just come and go. The pain is suddenly, or the pain is gradually. Gradual means like just go like 7 days ago I feel my pain just like very mild. I cannot feel anything, just sometimes just pain a little bit. But recently 3 days ago the pain increased a lot. This make me cannot walk. It means like we call this a course, the progression. Or the pain just come like suddenly, like when I walking on the street and the pain just come. We call this a course. Okay, for history, when we go to the medical history, how we can go detail about that and can help you to differentiate more about what how can you take it. All right, so just for the course, you can define by suddenly, gradually, or constant, or come and go. So it means the course. All right, but let's go with the next slide. We can see more detail about that. The duration, as I try to explain about associated symptom, well, like the pain come along with vomiting, nausea, or headache, kind of like the associated symptom. The factor can improve the pain, or the factor can help you increase the pain, or we want it to exacerbate. Exacerbate means make the pain worse. All right, so both sides. And the trigger the patient to explanation the cause symptom, like their own explanation the cause. Like sometimes they know well about the cause. Like sometimes they said like I get the pain when I see the dog. I get the pain when I see the snake. Kind of like that. So whatever. That just only the patient know that well. Let's start with that. Let's go with this stuff. Yes, this thing I just I already talked about that brief history of present units, and 1-2 elements, just Thuong pain, left knee, past 2 weeks, but the extended SBI is mean like you can go with more than 4 elements. Element just like the thing we just get through all this. The Thuong pain, the left knee over the past 2 weeks. Yep. And the pain start after his phone during the soccer pain game. The pain relief when the sitting, warm, compress, ibuprofen, and aggravate. This the vocabulary of in the words. Then this is equal with the exacerbated. Okay, by walking and standing. This means like increase the pain by walking and standing. I mean let's have more information about the extended HBI. So like we start with that. Everyone. So you can know well a little bit about what I'm trying to explain here. Location is mean you can go with the onset. Like we call this some of the key points can help you to evaluate the pain. We can go with the mnemonic like AAA. They can have many kind of way to remember that. As I know, some people they go with like so great, right? I know some people they like with so great, but that's look the same. Don't worry about that. If you get familiar with any type of the mnemonic, you just start with that. Don't worry. So the locations mean like the onset, the intensity, yes, scale of the pain, like you see here. The quality, like I talked like Dr. Ang and also me confirm about that. Action, burning, the onset. The location is a little bit different. The onset. It means like you talk about the not only about the entire the period of the pain, but also the pain is a permanent, and the pain like it means like whole the picture can start with the pain. I mean like any reason can start with the pain, kind of like that. And the location is mean like the place you have, where you have the pain. You can just answer kind of question like that. And some like how many words here? 1, 2, 3, 4, 5, 6, 7. sometimes we can combine with into. All right, so radiation, we know well, radiate to somewhere, like if the pain is chest pain, they can relate to the arms or the shoulder. It depends on kind of the reason with that. Aggravating factors or exacerbating factors or alleviating factors. So mean like this something make the pain decrease and something make the pain increase. And the last one, associated symptoms. So in like we talk about like the cause, like just the in this previous one, you can combine with like in the intensity and the quality as well. If you know about that, if you don't have information about that, that's okay. Sometimes the patient cannot describe to you like this suddenly come, or the pain just start with the very gradually in here. Yeah, that's scale of the pain. I wanna just get that. So for example, if I start with that, how you guys can make the question to ask the patient to evaluate their pain. When you see like that, you want to know about the severity of the pain of the patient. What kind of question you can start with?
Well, for scenario 8, like we can start with the question like from scale from 0 to 10, how would you like rate your pain, or how would you score your pain?
Yes, good job, Mr. An. And actually, I just want to add on a little bit. From the scale 1 to 10, with 1 is no pain and 10 is the worst of the pain you can have. How can you rate your pain? Just like you need to explain a little bit to the patient, to let them understand what the meaning of 0 and what the meaning of 10. All right. So, but your question kind of very like can have the patient can answer, but sometimes we need to explain more about that. Yeah, thank you so much, Vong. And let's so some kind of another useful mnemonic can help you to ask the symptom from, like collect a symptom from patient, like can go with the cold, rears, or even like go with the sit. It depends on you guys, and you can collect. It depends on type of the symptom. Not always like you have the patient come to see you in the pain, right? So sometimes they have another type of the symptoms. So it's just a character of the chief complaint, the severity, type, onset, location, the duration. Sometimes just need to be like that. And some like the reasoning like radiation, exacerbating factor, triggers, alleviating factors, related symptom or severity. Or you can go with another type, the mnemonic, like you want to take another or something related to the symptom of the patient, like sick. It means like sick context, similar symptom previously, insight into course, or treatment tries mean like do you have any, as we call this, maybe like the travel or some kind of thing, like you go with that symptoms. Sometimes like the disease can come with the reason you start with the trip. You go to somewhere, for example, like some people, they from the US, but they travel to the North or the South America, as the South is the Asia, they can bring kind of a symptom. So also that can help you to get diagnosis. So we finish with the chief complaint. We finish with the history of presenting units. And the next thing we want to talk, I want to deliver about the past medical history. And as you guys know well about the past medical history, include what you mean, right? So you need to collect about like the childhood illness sometimes, not always. If you recognize that a disease can relate it to the childhood history, so you can ask them about that. Or you can just measure adult illness, or you can go the past surgical history, medication and allergies. So for the when you go with the medication, you need to ask, maybe can be like this, prescription medication, over-the-counter medication, or some like herbal remedies, You need to ask about the dose and frequency, like I talked about this. And for the allergies, you can go with kind of like medication allergies, and some like kind of food allergies, or some type of the reaction. Maybe this is what kind of the hypersensitivity, or in the past they have sometimes have type 2, type 1. We call this the prophylactic, kind of like that. And they have like hospitalization before, or do they have immunization enough? Like COVID now, if you have immunization, you can get you have more protective. And for some in other kind of history for the women, you can ask some disease related to the obstetric and gynecology. All right, so you can go with that. And the meaning of that, the health status, description of the health status, and goal of this past medical history. It means you need to identify the important clues. The important clues mean like some evidence to support why the patient have that symptom or why the patient have that disease before. And some like contributing factors related regarding to current concern, or some developing some holistic approach. It means like the comprehensive management for this patient, kind of like that. Comprehensive is mean like in overall, how you can help the patient, how you can cure the patient with that way.